Hello wonderful people, welcome to my channel. Today is Sunday and on your health we'll continue our discussion on diabetes mellitus or sugar disease. Sorry for the change in voice as a result of weather conditions, so please manage it. Thank you. To throw more light on the types of diabetes mellitus, let's talk about the type 1. It's also called insulin-dependent or juvenile diabetes because it's mostly seen among children from the age of 11, 14 onwards. Yes, and adults too. There are some adults who can also have type 1 diabetes, but mostly it's in children, seen among them, and it will come suddenly. You won't know the reason or the cause. It can be that it's idiopathic, you won't know the cause, or it can be as a result of the autoimmune I talked about in the first video, which will cause your antibody or the soldier within you which fights against microorganisms or threats will then mistakenly be fighting against your pancreas and won't help in production of your insulin, or it can even cause total or absent production of the insulin, and it will cause increments of glucose in your blood. Yes, that is how it is, and it's not all that common. In terms of percentage, let's say 10% of people who will be suffering from that type 1 type of diabetes. And for the type 2 type of diabetes, we also call it mature diabetes as a result of the age. From the age of, let's say, 40 onwards, it's commonly seen among such people. That's the reason why we also call it mature type of diabetes. And for that one, I said it earlier, the cause can be obese. When you are obese or you don't do exercise, it can cause that, or maybe the kind of diet you take can also contribute to having such type 2 diabetes, and even aging can be as a result of causing that type of diabetes mellitus. And it's common, very common. About, let's say, 90% of people having diabetes is the type 2 type of diabetes, and it will be occurring gradually. It's not as sudden as the type 1. Gradually it will be occurring, so by the time you will realize, then there is increment in your sugar. We are not saying that as normal human being you shouldn't have glucose in your blood. There should be glucose in your blood, but it should be in norm. Yes, it should be normal. Let's say as normal human being you've not eaten and we want to check your glucose level in your blood. We call it checking of your fasting glucose level, and if you've not eaten, it shouldn't be less than 3.3 millimole per liter. Yeah, it shouldn't be less than 3.3 millimole per liter. And if it is less than that, it can also cause another condition. You can go hypo. Yes. And in terms of maximum, it shouldn't be more than 6.6 millimole per liters. I think it may be of different value, or there can be changes depending on where you reside, the country you reside, but your doctors will attend to you. They will expose the main figure that is necessary for you to have such glucose in your blood whilst you've not eaten. And even if you've eaten, we give you 2 hours to stay for us to check, and we call that one random sugar level. So all the value, we have the normal value of glucose level which should be in your blood. Let's talk about symptoms that will create you awareness that there is sugar disease or you are having sugar disease. In terms of sugar disease, there can be increments in urination as a result of the buildup of glucose in your blood during filtration. Once the kidney is filtering the unwanted substance, there will be a lot of sugar to be excreted, and that sugar can't be excreted just like that. It has to drag water in order to come as urine. So a lot of water will be absorbed out from your system and it will pass out as urine. We call it polyuria. Yes, so no wonder in terms of sugar disease you will be urinating a lot. And if you are urinating a lot, that means you have to take in a lot of water to replace those you've lost. Yes, and that one is called polydipsia. Yes, you'll be feeling thirsty always, and you'll be taking a lot of water. Increment of your thirst, you have to take in water. That is polydipsia. And because there is no source of energy, glucose to serve as source of energy, there is no in your muscles or in your cells, that means your body will use fats. It will be breaking down fats from the adipose tissue and protein from your muscle. It will be breaking them down and use as source of energy. That means you can even lose weight because it will be burning the fats within you, so there can be loss of weight. And because of that loss of weight, you will also be sensing hunger. Always your body will be taking those fats and protein as source of energy, and you'll be feeling hungry. That is polyphagia. We call it polyphagia. And you'll be taking much food, you'll be eating more. All these are signs that can prove for you to know that there is something wrong going on, and you have to rush to see your doctor. Don't even wait for such. Mellitus or sugar disease can cause a lot of complications. So please, if you've heard about your sugar level being increased from your doctors, or even you yourself, you've checked and you've been noticing such, don't waste time. Just go fast as your leg can carry you and report for us to start managing for you, because there are a lot of acute and chronic complications. In terms of acute, you can even have ketoacidosis, coma, which can lead to death as a result of the buildup of acid in your blood, which can cause that. Or a lot, like those chronic complications, you can even become blind. There can be blindness as of the loss of buildup of those metabolites. And you can have a lot of cardiovascular disorders, neuron disorders. You can have neuropathies. Even when you get sore or you get hurt, your sore can be healing as a result of sugar disease. And you have to take notes and rush to see. To bring our discussion to an end, as a diabetic, there is no need of eating overloaded. No, you have to limit the quantity of food you take, and make sure it's balanced diet. Don't take in too much sugar food or food that contains high glucose. Limit them, or even if you can exempt yourself, that would be better. And don't take in much saturated food, those fats, meats, butter, and other things. You have to also limit their intake. Do exercise. You have to do physical exercise, and don't be taking drugs which will cause harm to your pancreas. Don't be taking alcohol. Don't take alcohol, because all can cause harm. Thanks for watching. Share, like, comment, and subscribe to my YouTube channel on Doris Opompoku, and follow me on all social media platforms. Thanks, and we'll meet next week.